Today, we're going to talk about how to tell if a baby in the womb is healthy or not. We'll look at the signs that show everything's going well as signs that might mean there's a problem. Let's get started. Signs of a healthy fetus. 1. Movement. After 20 weeks, the precious life growing within the womb begins to make its presence known through gentle movements in the belly. These initial flutters and kicks are a wondrous sign of the baby's development. As the months progress, the baby's senses awaken, and by the 6th month, they start responding to sound, followed by light and pain in the 7th month. 2. Normal growth. Your doctor will perform an ultrasound to track the growth of your baby's health and development. Generally, a fetus grows by 2 inches every month, so, by the 7th month, your baby should be 14 inches long. By the end of 9 months, a fetus weighs around 6.6 pounds and 18 to 20 inches long. 3. Heartbeat. Another measure of a healthy pregnancy that will be taken consistently at your antenatal appointments is your baby's heartbeat. Fetal heartbeats can be heard from the 5th week of pregnancy and will range from approximately 100 to 160 beats a minute. 4. Weight gain. Weight gain during pregnancy is a surefire sign of a healthy pregnancy. Usually expecting moms gain around 25 and 35 pounds when they are pregnant. You can check your weight regularly and update your doctor about the same if there is a major change. The belly should also grow in size as the months pass by. 5. Fatigue or sickness. Embarking in the first trimester of pregnancy, you may encounter a unique sensation of morning sickness, accompanied by a feeling of weakness or discomfort. Surprisingly, this common occurrence actually plays a vital role in reducing the risk of miscarriage, signifying a healthy pregnancy. Embrace the slight bloating, occasional bouts of nausea, and even moments of vomiting as reassuring signs that your body is nurturing the precious life within. 6. Enlarged and sore breasts. In the early stages of pregnancy, the delightful rise in estrogen and progesterone levels may lead to a tender and sore sensation in your breasts. While this hormonal surge can make your chest feel heavy, it also signifies that your body is successfully adjusting to the beautiful journey of pregnancy. Signs of an unhealthy fetus. 1. Low HCG level. HCG hormone levels do fluctuate during pregnancy. But if the levels continue to decrease, it can signify an undeveloped fetus, and if it happens, you need to contact a doctor for further examination immediately. 2. Abnormal fundal height. Fundal height is the length from the top of the uterus to the pubic bone. Usually, after the 16-week mark, fundal height matches the progress of the pregnancy. If the height of your uterus is not what it should be, it indicates a problem with your pregnancy. The reason may be too much or too less of amniotic fluid or a breech baby. In the worst-case scenario, it could also mean that the fetus is not developing in a proper manner. 3. Lack of or no heartbeat. Sometimes the lack of a fetal heartbeat does indicate a miscarriage. If you saw a heartbeat at an earlier ultrasound but not at the next, that's a pretty clear indication that something isn't right. The heartbeat should be getting easier to detect, rather than more difficult. 4. Excess cramping. Pregnancy comes with its share of pain and aches. However, extreme pain, which feels like menstrual cramps, is another warning sign. In early pregnancy, if you feel excess cramping, you might need to consult your doctor. 5. Bleeding. Bleeding during pregnancy is a matter of concern without a doubt and needs to be evaluated by a doctor. It might be a sign of miscarriage, hormonal bleeding, or implantation bleeding. 6. Extreme back pain. Experiencing back pain is common during pregnancy as the growing baby puts a lot of strain on the spine and lower back. Consult your doctor if the pain becomes severe as opposed to a dull ache in the back and it starts from the front of your body and makes its way to the back. 7. Vaginal discharge. Usually, the vaginal discharge of a pregnant woman is clear, transparent, whitish, and odorless. However, if you notice a yellowish or greenish discharge with a strong smell, then it's time to consult your doctor, as it might be caused by cervical inflammation, a sign of miscarriage. 8. Sudden discontinuation of morning sickness. Usually, morning sickness resolves itself by the end of the first trimester or even earlier. However, for some pregnant women, sudden discontinuation of morning sickness might be because of low HCG levels, pointing to a miscarriage. It's advised to seek an expert's opinion and make sure there's no threat to your baby. 9. No fetal movement. Fetal movement can be felt around 20 to 24 weeks in first-timers as the fetus starts reacting to sound, light, and pain. Experts say that a pregnant woman should experience at least 3 kicks every hour during this period. If the fetus is in distress, the count declines. It's a clear sign to consult your doctor for proper treatment. Pay attention to what the signs say. Consult your doctor even if you have a minor doubt or feel something is off. Your concern might be futile, but it's always good to be safe than sorry. Subscribe our channel for more pregnancy and parenting videos.